Hi guys, welcome to Chapter 1 of our Dry Eye series, Diagnostic Testing, brought to you by iLab. Dry eye syndrome is actually a lot more complicated than just having dry eyes. You may not realize that in fact it is a chronic and progressive disease affecting up to 50% of the world population. This is the tear film in our eyes. It consists of 3 layers. First the oil layer, then the water layer, and the mucus layer. And dry eye can occur when you either have deficient tear film or a poor quality tear film. And it can be caused by many factors, from medications to your eyelid conditions, your lifestyle or diet, and your medical history. Because dry eye can vary so widely in severity and type, to find the best treatment tailored to you, you'll really want to visit your optometrist for a thorough dry eye assessment. In this video, we'll walk you through the dry eye assessments that we do here at iLab, including the different dry eye tests, how and why they're done to guide your treatment plan, and what to expect at your appointment. Before you come in for your assessment, our dry eye team will send you a dry eye questionnaire to fill out, which will tell us everything we need to know about your medical history and overall health, including any surgeries or medications that you're taking. You would be surprised to learn that even your skincare medications can affect how your eyes feel. Once you're here, you'll be asked to fill out a standardized survey which asks you to score the severity and frequency of your dry eye symptoms. The first test that we'll start off with is the tear film osmolarity, which is a measure of how salty your tears are. Increases in salt content can cause tear film imbalances, often seen in patients with dry eye. The device that we use here is called TearLab, a handheld device that is held up to the corner of your eye, taking a small sample of your tears. It then reads off your tear osmolarity score. A score below 300 is considered fairly normal, and anything above 300 indicates a loss of tear film balance. More severe dry eye is reflected through higher scores or large differences in readings between the two eyes. Next, we'll measure the TBUT, or the tear breakup time. Your tear breakup time is a measure of how fast your tears evaporate. Every time you blink, your tears are redistributed across your eye surface in a thin coating known as the tear film. In between blinks, this coating will break up and tiny dry patches will develop. You'll be holding your eyes open for as long as you can in front of a special camera that captures a video of your tear film after a blink. Having healthy, good quality tears will slow down this process and keep your tear film stable. However, in patients with dry eye, they may have insufficient oils to prevent their tears from evaporating. Next, an anterior capture of your eyes will be done to evaluate and continuously track the redness of your eyes as an indicator of inflammation and dry eye severity. Next, your tear meniscus height is measured. This is essentially a measure of the depth of your tear film at your eyelid margin, or in other words, a measure of your tear volume. The next test that we do is meibography, which is an imaging technology that takes pictures of your top and bottom eyelids in order to examine the quantity and health of the oil glands inside. These oil glands are the rows of white stripes that you see here. For many patients, these oil glands get inflamed and clogged up and eventually die off. When this occurs, you may produce insufficient oil or poor quality oil, and without oil protecting your tears, they will evaporate very quickly. The next test is the Inflammidry test. This simple-looking test stick is similar to a pregnancy test. The device samples a tiny amount of tears and detects whether you have an inflammatory protein, MMP9, in your tears or not. This is an important test because this protein is often found in the tears of patients with dry eyes and is an indication that inflammation is actively occurring. In the next test, your doctor will apply a drop of fluorescein dye to your eye, which will bind onto dead or damaged cells on the surface of the eye. When looking through a blue light, they will glow green, showing your doctor the location and intensity of any surface cell damage. Surface cell damage can occur for many reasons in dry eye, including inflammations or tiny abrasions because you don't have sufficient tears to lubricate the eye surface. The next test is the gland opening test, during which the doctor will use a small instrument to apply pressure to your eyelid margin, where your oil gland openings are located. In healthy eyes, this pressure will cause oil glands to open and express clear liquid oil. But in patients with dry eye, these glands may be clogged or atrophied, so it will not express oil. Or it may express poor quality, cloudy to transparent, toothpaste like oil. Now that we've walked through some of the diagnostic tests, it's good to know that these are important objective measures of your dry eye severity. Sometimes the patient's experienced symptoms may not match these clinical signs or vice versa, and that's why it's very important to use these measures as trackers of the patient's treatment progress. If you have any questions, feel free to let us know or schedule an appointment with the dry eye team. We're so excited to see you at the dry eye consultation.